Hi again, I'm Ed Podlowski of Morningstar Actuarial Consulting. This is the third in a series of videos bringing insights into how large self-funded health plan sponsors can best assess the value propositions of health plan disruptors or innovative healthcare solution providers both before and after the purchasing of their services. In prior videos, we provided an introduction of the innovative healthcare solution space and the issues faced by plan sponsors in trying to assess their value propositions. And we offered an overview of the process of achieving these goals, which are really best practice. Prior videos on this topic can be found at our website at morningstaractuarial.com. In today's session, we're going to cover the first phase of the process, the current state assessment. And what I like about this is it really involves some detective work and reminded me of one of my favorite literary characters in Sherlock Holmes, but we'll get to that in a little bit later. So before we start, here's a graphic of the process just as a reminder. So memorize this, so don't be a test at the end. Okay, I wasn't serious about the test, but hopefully this gave you a perspective on the process. The current state assessment is really an opportunity to review all aspects of your health plan, including plan design, member demographic profiles, plan enrollment patterns, which really includes enrollment by plan type, by division, by geography, and any other categorical breakdown that is important to you, as well as employee preferences and satisfaction levels. However, for this session, what we're really going to focus on are the cost and utilization patterns that underlie your health plan's claim experience, and really trying to assess what's going on in driving your costs. So data accumulated from insurers, third-party administrators, healthcare data management systems should really be used in conducting analyses of the plan sponsor's healthcare experience. The focus of this analysis, as I mentioned before, is really to determine the main drivers of plan sponsors' healthcare increases and potential quality of care issues that are really systemic within the population covered by the plan. As I mentioned before, while two organizations can have the same level of increases in costs from year to year, what generates those increases can be distinctly different. Analyses should review annual changes in both the utilization and price components across the spectrum of service categories and disease states. It's also important to compare plan experience against benchmark data for outliers, as costs may not be increasing significantly, but may be out of line with the market suggesting other issues. The slide I'm about to show you is going to give you an idea of a starting point for the analysis and really shows you the information on the utilization statistics that I mentioned, but a similar chart could be produced for both the cost of services as well as the per employee per member or per employee cost. This chart is typically used to start the analysis and should be available from any data management system or from your health plan administrator. Subsequent drill down analyses will require additional data analytical capabilities, and I'll get to that in a little more in a little bit. But let me give you right now an example of an analysis and the solution that resulted, so you really get an understanding of what we're talking about. I've done some work for a large self-funded association that's really made up of a bunch of small manufacturers, totaling about 150,000 members in total. And when we conducted our review, inpatient hospitalization costs look slightly above normative data. Utilization rates look fine, year-over-year increases seem fine. But when we compared inpatient hospitalization costs, the cost per admission, it seemed high compared to normative data. We did further drill down and look at the types of services, the types of conditions that were causing inpatient hospital utilization. And what we found was there were an inordinate amount of C-sections being performed compared to normative deliveries. In fact, 25% of all deliveries were done by C-section. And the reason that was extraordinary is that healthy people targets suggest that should be around 15%. So we started to dig down a little bit more into that, and in working with the health plan, got behind some of the information, including the diagnostic codes, which indicated that many of the C-sections were being performed because the prior delivery was a C-section. So again, working with the health plan, we went back and identified that the vast majority of the C-sections being performed by the physicians were being performed because the prior delivery was a C-section. And that was really no longer a recommendation by the American Medical Association. So what we ended up doing in working with the health plan was to put together some provider education around this topic, and then looked at the data a year later, and what we found is that C-section rate actually dropped to 20%. So not only did we have better quality outcomes for both the mother and the child, but we had reduced costs of both the plan as well as the participant because the overall cost was now lower. So as you can see from this example, conducting the data analytics for the current state assessment really helps to have the skills of an actuary who can assess what variances are systemic versus those that are simple one-time events. A data scientist, which really has been a skill set of actuaries even before the term was in vogue. And as I mentioned before, a detective. You really have to dig into the data and see what's going on to determine the ultimate problem and the subsequent solution. So as this example pointed out, we did do some further drill down from the initial analyses, and that involved looking at things like the provider, geographical areas, disease states, episode of care, and chronic condition, among others. It may also likely involve getting into some of the very detailed claims codes, such as major diagnostic categories, ICD-10, CPT-4 codes, and national drug codes. So understanding your cost drivers really allows you to focus your efforts on providers that match your needs, limiting the field from really hundreds of entities that are seeking your business to just a handful that can address your more immediate needs. Conducting these analyses annually will help determine whether priorities should be changed and whether solutions are making satisfactory progress. This information will also be helpful in the development of the guiding principles, which is really the topic of our next video. So if you want to read more about data analytics, just go to our website at morningstaractuary.com, and we have a brochure on this, which also includes some of the charts that I had mentioned. Also, an article on the topic of evaluating health plan disruptors, which was published in the first quarter 2020 edition of Benefits Quarterly, is also available on our website. Benefits Quarterly is published by the International Society of Certified Employee Benefit Specialists, and the article is available under both the Solutions and News and Articles section of the website. Again, if you want more information, please feel free to reach out to me via email at ed.podlowski@morningstaractuary.com or through our website at morningstaractuarial.com. I look forward to seeing you on our next video.